Hello, I'm Julio from IVF Daddies, and today we have a special guest.
Hi, I'm Luisana. I'm from HBOT for Life.
Hi, Luciana, how are you?
Good. How's everything with you?
It's great, great. So we're here in Ibiza, and I don't know if most of you know, but Ibiza is becoming a little bit of a wellness,
Imperium.
wellness retreat, and now it's like a wellness empire.
Yes.
And what do you actually do?
So, HBOT for Life is a company that manufactures hyperbaric oxygen chambers. And I'm the owner with my husband. So we manufacture together this device, this medical device.
So you manufacture for other people, or you manufacture and you have your clients coming to you?
Well, we do the manufacture. So basically, we sell these chambers to patients, we sell the chambers to clinics, to hospitals, and we also treat people because we have our own clinic as well in here.
Oh, wow, that's amazing. So you only have at the moment in Ibiza.
And in the Netherlands as well.
So because I remember being in New York, and so I tried the hyperbaric chambers, but I've tried it for no reason.
Yeah, without a goal, basically. Yeah, yes.
I didn't have reasons to go, and I was in my 20s. I mean, and yeah, you really feel refreshed. That was the experience that I have as a memory. So how would you say have changed from like years ago, like 5 years ago to now, to people that are using it to just feel refreshed or to be like a luxury item to something that will actually improve your health?
Well, let's start with basically hyperbaric oxygen therapy. It is a medical treatment, okay? So, yes, it is a medical treatment. The only thing, yes. So the only thing is that you can use it without having a medical condition because oxygen is like the fuel that your body needs to work better. So it doesn't mean that because you don't have a medical condition, you cannot get a benefit, from it. Because sometimes we are asymptomatic, like we don't feel that something is happening in our body. But actually, yes, our body is going forward with an illness that it might happen to when you are 50, 60, 70s.
Yeah, it's usually what happens with cancer and
Exactly,
fertility.
exactly. So I always trust, that it's better to prevent, that something happens to you. And for me, oxygen therapy or hyperbaric oxygen therapy, it is one of the best ways to actually prevent and to put your body in such a state that you are free of a medical condition as long as you can. Okay.
So what? What would happen if I have no medical condition and I still have the machine and I still go to your sessions because I enjoy the results?
Okay, well, let's put it like this. For example, I don't have any medical conditions, thanks God. And then basically, every time that I go inside the chamber, what I notice is that my skin looks amazing, my nails grows a lot, my hair as well, I have a lot of energy. Sometimes, when I feel that I don't want to send that email, I don't want to talk with this person, I say okay to myself,
Like a burnout.
yeah, exactly. I go inside the chamber, I breathe oxygen,
How long?
for an hour and a half. Yes, like 90 minutes. Or sometimes I sleep a little bit in there. I take a nap or something like that. And then I get out of the chamber and you see me energized. Like I'm like cleaning the kitchen, like talking on the phone, like that. I feel that boost of energy, in my body.
Oh my God. And also what we were saying a second ago, that people don't believe you as an owner of a company because you look 12.
Yeah, exactly. That's also true, because sometimes when I have to talk about experience, when I have to talk, yes, this is going to help you, they start, are you a doctor? Are you this? And then I'm like, no, I'm not a doctor, but I am hyperbaric specialist. I've been studying this for the last 5 years. I am really, I know what I'm talking about, and they are like, I feel that in their heads, they're calculating, how old I am, yeah, yes. Yeah. Yes, and then, when I start saying, that I also manage, the business part of the business, it's also like, you're lying to me.
Yeah, because if on the superficial side, if it's just like it can have the skin that you have, it will definitely be in the hyperbaric chamber.
Yeah.
But so what does it take to be a hyperbaric specialist? What does how many years of study is it?
So there are like different certifications, okay? There is the doctor that does, as you are like a cardiologist, for example, you become a hyperbaric specialist, or a hyperbaric doctor. So, for example, here in Ibiza, there is only one doctor that is a specialist in hyperbaric medicine, and is the director of the Rosario Hospital. Then there is also courses, okay? In the United States, it's more advanced, the hyperbaric medicine, so you can find a lot of courses over there. So I did a very, very nice course with someone that has more than 17 years in the market, for hyperbarics. And I did around 1 year and 8 months course with him. In the hyperbaric oxygen environment. And then since then, because all the amount of patients that I have, basically constant learning, because when someone comes with a medical condition that maybe I don't understand, I'm the first one that I'm like checking all the medical studies to see what HBOT can do for this person. And especially because when people come to me, is their last resource,
So what you're describing is basically what we face in the IVF podcast, is a lack of knowledge on certain aspects of the body, and it's almost like the medical industry works on a pyramid, like on a structure. Mm-hmm. And then there's a lot of things like fertility, egg count, motherhood, like your genetics that you don't really, what you were saying, that you're asymptomatic. And then a lot of people don't know anything about their fertility education or their infertility. And when they come to us or to Richard, my boyfriend that works for IVF, then these people come as a last resource, and they feel like they're broken, or like they're not, like women have been saying to their bodies, like, we're not gonna have a baby. And then the moment that you say yes, after you're taking like contraceptive medicine, or you're working, you're adding stress, and then now when you want to have a baby, like, it's not as easy. But that's nothing. There's not a pain. You don't feel it. You don't and then that's when they try to do everything they can. But what is surprising to me is that people don't tell you, do you want to check your egg counts when you're 18 to see 19, 20, 25? Do you want to freeze your eggs? So I'm assuming that that's kind of what you get with your clients.
Yes. Basically, just to try to mix, some information from what you're saying, and also from what I know. My patients, I have like patients, with very strong medical conditions, or with maybe with autoimmune medical conditions, that basically their medicine, there is a point that the traditional medicine stops, that basically it reach a point that they say, okay, well, you can only take this pill, and you will have pain for the rest of your life. That's your life now.
It's almost like they treat you, it's like a treatment medicine instead of like a healing medicine.
Exactly. Yes. So then this person that has, let's say, like, I had a patient, just to tell you a little bit the story of this woman. She's from the United States. She came to us maybe 2 years ago, and she used to have, she has Lyme disease, and she used to have also an autoimmune disease also that was attacking her body. So the Lyme disease was attacking her body, and then she also had a broken back. Okay, so like some ligaments, she could walk, no problem, but pain all the time. When there is pain in your body, it's because you have inflammation, okay? So that's the first reaction from your body, is to tell you have pain. It means that you have inflammation. So this woman cool than she was, a brand manager, like super successful in the United States. She was working all the time on a laptop, like working from her laptop. She couldn't sit anymore in front of her laptop and remember what she needed to do. Like her brain was in that stage.
Shock of nervous system.
Exactly, yes. And she came to us. The treatment, it is expensive, and especially if you are not working, it is expensive for you, for the patient. And this is not covered. Like the medical insurance won't cover any medical conditions that is not FDA approved.
So this would basically be like a
Out of her pocket. Yes, like if it's aesthetic or something else.
So, and what does it take for it to be part of the FDA?
Well, the FDA, unfortunately, only covers 14 medical conditions that are, for example, if you had a crush injury, that something fell on you, and you were crushed by something. If you were on a fire and you inhale carbon dioxide, if you survive chemotherapy or and then your wound, for example, if they remove your breast and your wound doesn't heal.
For the hyperbaric chamber to be approved by FDA
Yes.
and covered.
Yes, exactly. So if you are telling me that my skin can heal a tissue that cannot be regenerated anymore, imagine what can do for your body for something mild. Yes, for something mild that is working. Yes. So, well, to come back to the patient, she offered me, look, I cannot pay for the treatment, but I'm very good. I'm building websites, like with the brand and all this. What if when I feel better, I do your website and I'll do all your branding? I was like, okay, deal, because I also need a brand girl and I haven't hired anybody. So she started doing she did in total 56 sessions. At session number 20,
How many?
56. So at session more or less 20, she started working again with me. She will sit in my house for 5 hours to talk about the branding, to talk where all our goals, all this. Yes. And she left. Well, she left me a note, when she left back to the United States, saying that I saved her life. Because she was really considering to end her life.
That's amazing. The fact that you can have something that, I mean, just to me to hear, first of all, that FDA approves for certain conditions, that means that they're giving you this type of approval. They just don't want to give you 100%.
Yeah.
So they're definitely saying that it works.
Yes.
And having somebody that went from not being able to sit or work. I mean, that first of all, for you to say yes, that means that you definitely believe in your.
Of course, in that.
If somebody's that fried coming to me, I would be like, I don't.
Really?
Okay, so let's say that people have not seen these hyperbaric chambers, and they could think that that is like a X-ray machine. What would be? How can you compare it or describe it?
It is a pressurized chamber. You go inside and you will be breathing oxygen. Okay. There are different chambers in the market. There are chambers that are multi-seat. Basically, you have 14, 10 people, sitting beside you, all of them hooked to a mask, breathing oxygen.
That's the future.
Well, I will tell you something just now, in a few. So then there is these monoplace chambers that you lay down by yourself and you breathe oxygen with a mask, or you can be pressurized with oxygen, okay?
Like in a bed.
Exactly, yes. And then there are the soft chambers that are the chambers that the elite, the sport elite players, they use to regenerate after a game, after when they had an injury.
That's the one that is like a zipper bag.
Yes,
You
exactly.
can basically go in with your computer, iPad, and watch.
Yeah, exactly, that one. But that is 1.3 ATA. That's mild hyperbarics. It's more for regeneration.
Okay, it's more for recovery of.
Yes, exactly. So most of the studies are made in these huge chambers, that they are in hospitals or in these big universities, and all of them are 2.0, 2.2 ATA, which is more pressure.
What are the ones that you use?
medical chambers that are up to 3.0 ATA.
So can you overdo it?
No.
Can you get consequences by overdoing hyperbaric chambers? Can you, is there a limit or?
You are coming already with a medical condition, okay? So you are coming with a goal. You want to improve or you want to regenerate your body to be able to conceive, okay, to have a baby. So it means that oxygen will heal whatever is happening in your body that is not allowing you to have a baby. So, of course, there is like many factors, and each woman and each man, because also we need to consider that sometimes
It's 50-50.
Exactly, yes. So each woman and each man, they have different bodies, and everybody can have like a different outcome from the treatment. But all of them are coming with a medical condition already. So there is no overdo it, like of oxygen. Oxygen can be toxic, but only if I leave you 7 hours inside the chamber.
It's something that I read. It's probably not related to the hyperbaric chamber in one part, but the other part, yes, that you just mentioned. So there is a study, there is a baby on the risings from after Ozempic use, because Ozempic is GLP-1 agonist, which it develops insulin, which it processes food and fat and glucose faster. This is not the proper technical terms.
Vocabulary, yes.
The statement and argument is that there's a Ozempic baby on the rising because Ozempic is reducing inflammation due to lack of not only the food, but like people are stopping drinking or smoking. It's like almost like an anti-addiction medicine. So if you're saying that Ozempic, due to inflammation, is making people have babies, so you're saying that the biggest, to me, my biggest threat is inflammation. So I know when I feel inflamed, I can feel it in my body, I can feel it in my joints. I will be the one taking like a ibuprofen for breakfast and for dinner. And then if I take care of myself and I take advantage, reduce the inflammation, my body is completely different. So what is the impact on your hyperbaric chambers and inflammation?
Well, look, I want to comment first in the Ozempic and the inflammation part. Right now, like I believe that 80% of our diet is inflammatory, okay? We drink milk, we eat cheese, we eat yogurt. All that causes an inflammatory response in our body. So if you reduce that because you are taking or you are like consuming the medicine, like as Ozempic, it means that your body is detoxifying for all this crap, that we put in our body. Which means that you are creating a better environment, for your body to be able to conceive. A body that is sick, that is inflamed, is not a healthy body.
It's almost like we're so used to inflammation
that you don't feel it anymore.
I don't know if it's that you don't feel it. It's kind of like we're idolizing to like sleepless night at work. We're idolizing to like get home and be like tired and depleted from work, bragging about how much you work and like or don't have time to eat healthy. And our life is driving us to take these decisions that keeps our body sick. Before we didn't need to work, like this many hours on our phone, or like be checking, like maybe have a coffee at 7 p.m. because I have a meeting with someone in the other side of the world at 3 a.m. So, like the trend of our body of getting sick is on the rise, and more illnesses that are related to inflammation are showing, in our body. Because what we eat as soon as we maybe wake up, or a coffee, yes, a yogurt, and just because it says a zero fat, you think is the healthy yogurt.
Yeah, but like our body is not able to consume milk, like we cannot digest milk.
I mean, I love butter. I love milk, and it's just it tastes delicious. It's great. But there was a time that I went on a study out of my mental health and my eating disorder and my depression that I was feeling so much pain that I would never believe anybody that would tell me that they go through the day with no pain. I would find it impossible. Like,
Imagine.
that my doctor will ask me from 1 to 10, what do you feel pain? I will say 15. Like I would have ibuprofen in the morning, afternoon, and night. Like I couldn't just. And then I decided to go just eat this. Like if something has a graphic design, I don't eat it. So I decided to eat like the way comes from nature, and then I started eating the same thing every day. And when I got rid of milk, it's like after 1 month of getting rid of dairy,
Your life changed.
like my body was used to digest it, and then I wanted to eat it again, and it was like, oh my God, like you feel like there was two things that happen: gluten and dairy. Gluten in the United States, like it's like if you're in Europe where like things are more fresh, it's kind of a little different. I don't know why, but it still affects me. But gluten or dairy, if I eat, I immediately feel it in my body. I feel it in my stomach. I feel it. And then, of course, now it's more about the way the milk is processed and what happens to the cows. And you have to basically induce the pregnancy.
Yeah, no, all that horror story. Yeah, I don't want to know anything else.
Stuff. And every time I eat dairy, like I noticed it and I feel it. And I know exactly where it hurts. I know the joints that hurt because of inflammation. And I know the fatigue. And basically, you just described myself when you were saying that you have to have a coffee because you have a meeting with the other side of the world, 3 a.m. Because my clients, like I have clients in San Francisco, I have clients in the US that I have to have meetings at 2 a.m., 3 a.m., and I sleep really little. Like I don't sleep that much. I mean, if I could sleep like 1 hour and you can tell me that I can just recover, I would just might be possible.
Well, I have a patient. He came here in Ibiza to do sessions with us. He did 5 sessions and then he was like, I want one. Yes. He suffers of severe autism. He doesn't sleep. And he goes in the chamber. So he sleeps 1 hour and then he can start going like crazy, you know, like
my dream, because I'm terrified. I don't know why, but I need to find out why I'm my therapist, but I'm terrified to sleep. I don't know why I sleep 4 or 5 hours a day unless I went out and I drank a lot.
Okay.
Unless it's like that one day of the week where I crash. And then it's like my brain is like,
yeah, you're wired all the time. Also, you know, what I notice when I use the chamber, because I also sometimes, you know, like feel a lot of stress with all the things that I do, you know, like I have patients, I have clients, customers, I have very demanding customers because, of course, if someone wants to buy a chamber that it is above the 100,000, they want like a super service, you know, so I also have like moments that I feel that I cannot sleep, that my mind cannot disconnect. And I can tell you that I go in the chamber and my best night recover is sleeping in there. Like 1 hour.
Have you taken your phone to the chamber and work in the chamber?
I fall asleep. I swear to God. I have tried, you know, like because I want to get things done and I need to focus. You know, I don't want any distraction, you know. I fall asleep.
So then now, okay, so now you're touching a point that is really important because I was just talking about it. It just keep coming up multiple times. So you're a woman. You run your business. Do you have kids?
No, I don't.
Do you want to have kids at the moment?
No.
Okay, so you don't want to have kids.
Well, not right now. Maybe in 2 years.
Maybe in 2 years. But
and I would like to say something straight away. And I'm not afraid of like not having kids, you know, because I trust so much in my therapy that I'm not afraid of that.
Okay, so you wouldn't go for freezing your eggs because you trust your machine so much.
Yes, exactly.
Don't have an issue with that. Because when you have something that is relatively new and still considered vanity, like it's not a necessity or it's
relative new.
that is not scientific proof that it will work as if you will go and trust a doctor for
fertility, for example?
let's say for fertility. Let's just keep it in fertility, because you just mentioned this, the FDA has approved for 14 treatments.
Yes.
But then if you go to other places, we're talking about like privileged locations like America, Ibiza, Netherlands. But if you go to Mexico, Venezuela, or Panama.
Surprisingly, there is like hyperbaric chambers even in Venezuela. Yes, because my dad, unfortunately, he died. He passed away, like just a few months ago. But he had a stroke, that is ACV. A stroke. And guess what I told him to do?
Hyperbaric.
Exactly. Yes. Half of his face was like, like a little, like frozen, and his body, he was struggling with mobility. And he did 10 sessions, recovered, 72 years old.
Especially at that age.
This is a clinic only of hyperbarics. It's in La Candelaria.
Oh, so it's not like somebody has one in their house.
Yeah, it's a clinic, yes. The medicine or the industry that gives you pills is so strong that you cannot claim, I cannot tell you, I will cure your cancer with hyperbarics.
Yes. Well, even any doctor, they will have 99% success.
Exactly. Just because the hyperbaric oxygen therapy is not, for example, the treatment of cancer, I cannot recommend it to you as a doctor. That needs to be you that on your own research decide to do it.
Use it as a complementary.
Exactly.
Okay, so yes, you just formulated in the right way what I was trying to say, and thank you for that. That what I was trying to say is, since it's not something that a doctor can prescribe, that it will cure you, and I know that this comes out of insurance liabilities. It doesn't come out, because what is the bounce back or the reaction, the negative feedback or reaction, or the things that you can get from the hyperbaric chamber that people are getting either upset or not believing in it?
We are very used to that you take one pill and your headache is gone, So the thing with hyperbarics is that you need 20 sessions, 40 sessions, 60 sessions. So it means that you need to give me 60 days of your life. It is a long treatment. So, if an antibiotic can do this for me in 3 days, why I'm going to go to the natural way? Because it's oxygen. We breathe oxygen every day. So this will be a natural way to heal, And I tell you, look, your infection, your virus, or your bacteria will be gone, but I need 20 days.
Well, we all know the impact of pollution.
Yes.
When the oxygen is cleaner,
you also feel better.
It's also that, I don't want to do the work. I don't care.
Exactly. This happens, and imagine that, that the hyperbaric chamber that you have closest to you is an hour away. And then you need to drive 1 hour, and then you need to stay 1 hour and a half inside the chamber, and then drive 1 hour back. You're not going to do it. People come to me when it's the last resource.
Oh my God, that's kind of sad to have the fact that. Why do we have to wait until it's
until you are so sick, that you cannot even deal with yourself,
And then what would be the difference in relation to the hyperbaric chamber for, there's one thing about egg count and quality of egg or embryo, and there's a difference between your endometriosis or cysts or your ovaries. I
would like to start with the egg quality, okay? So basically we are born with a quantity of eggs, okay? And imagine that it's a cup, and then we start using the ones on top, when we are younger, and then the very, very end are left, when we are 40. So, but those ones have been sitting there for a long, long time, okay? They're not receiving enough blood flow, oxygen, so they are not as nice as the one. Exactly. They're not as nice as the one that were on top, okay? That are already gone from your body. So when these eggs, that they are the last few that you have in your body, starts going into your system, they are not as strong as the older ones, because these are like old eggs. They're tired, So by putting oxygen in your body, you can oxygenate your eggs, you oxygenate your uterus, you oxygenate the lining that covers your uterus. When you do hyperbaric oxygen therapy, you are creating a better environment for your eggs, for your body, and for you, for your new baby, to happen, So there are some studies, some medical studies that says that by doing hyperbaric oxygen therapy from the second day of your cycle until like the seventh day, when they extract
How many days of cycle does people have?
5.
Okay.
Yeah, from the second day until the seventh, like that's 5, Okay, so by doing it for those days, the quality has improved so much that the rate for doing IVF, the successful rate, it is already like 3 of 5 will go through pregnancy.
Oh my,
Yes.
go through like a successful embryo.
Yes, exactly.
The reason that I started doing this podcast is because I am not a woman, and
Yeah.
I've never understood. I've noticed now that most women don't know their fertility bodies. And also, as you said, it's something asymptomatic. You don't know until you try, and also eggs are like an onion. You don't really know until you like put it to work.
Yeah.
And to hear this is, I mean, it could give just a lot of hope to a lot of people, because I have seen patients have to go through 3 different cycles of IVF to get embryos to work.
And the stress that causes to your body? Well, the stress that causes, like to the women. Imagine, like having that all the time on your head, that the only
social pressure.
Yes, that the only thing that a woman maybe, or well, I don't want to say that the only thing, but yes, your body is designed to be a mom. What you mean that you can't, So I believe, that for women, the pressure that you put also on yourself is so strong that I believe that even those eggs that you are putting to IVF are coming, I also believe a lot of an energy, they are like charged, also with that energy.
Also, it's also the fact that, but the fact is, like, men, and this I know because we've interviewed doctors, and I didn't know what an andrology was until I interviewed an andrologist, which is like the gynecologist of men, the one that studied the sperm and the quality of fertility of a man, not the urologist, but the fertility of a man. And if we have an issue, let's say, people that go like cyclists, like they really harm their egg making and their testicles.
Yeah, the sperm, yes.
Not egg, sorry.
Yeah, the sperm.
The sperm. Party, you go out, you have stress, you go through chemotherapy or whatever. You wait 3 months, and then you have a whole new batch regenerated of sperm that you can go on a diet, you can cleanse, you can like detox. Women don't have that. Also,
we are the person that carries, the baby. So we are a little bit more energy focused, So being in a stressful environment for the women will affect, in that length, every cell of our body, including our eggs. But something funny that you just said about the men. Yes, the sperm can be regenerated. But the food that the men consume, the alcohol, the smoking, also the quality and the amount of spermatozoids, that a man carries, this diminishes.
The difference is that there is this social pressure, because a man would never say, I don't know if I'm going to feel connected to my kid because I'm not carrying my kid,
Mm-hmm.
Like in women.
Yeah.
And that's when I say that there's a lack of education, because if somebody tells you, oh, it's normal that you could get pregnant and you could not get pregnant, and if you don't get pregnant, there's alternative medical routes that you can take that will help you create a family. There's a taboo of like feeling broken, or feeling like, if like, well, now that I did my career and classes and now I want to have kids now and I can't, I'm like, like it almost feels like everything else is forgotten and your only role is to be a mother and you're not functioning as a woman.
Yeah, anymore. Let's say like this. Yes. Yeah, like unfortunate, like the system is broken in that way, because after we did everything that the society believed that we needed to do, go to college, have a have a nice career, like have the house, have the car, have this, like now you can have the family. I'm like, yeah, but I'm 40. Sorry, like well, nobody told me this before,
And also, like, what if you don't want to have the family, or what if you just want to be a mom, or like a work, like, because I feel like there's so much guilt. There's so much guilt that women carry by other. I mean, I'm really proud to have in this podcast from Venezuela, running an international business.
Look, I would like to tell you, like some like amazing facts about like doing hyperbarics in general, for your body. Like not only in relation to the infertility or the fertility programs, that we can also offer. For example, in the longevity area, in 2020, an Israeli doctor proved that you can reverse aging, in your body on a cellular level.
I'm sold.
Yes. And I'm not saying also, what happens to your skin, because that's the most, let's say, superficial part of your body. But imagine reverse the aging 25 years inside your body. So it means that maybe you are not going to get Alzheimer, when you're old, because your cells regenerated. So when you are 80 on a cellular level, maybe you are 70, 65, So imagine that.
Wow.
Okay. So this doctor discovered that your telomeres, that is like basically a chromosomal cell that is very directed.
Is that the one that gets shorter? And
Yes, exactly. So they start to reproduce or to length again by
not only stops decreasing
the length.
it
Yes.
regenerates.
Yes, exactly.
That would be like the fountain of youth.
Yes.
It was important for me to talk to you as a woman running a business, as a woman, which actually you probably are the second person that described the ovarian system better than all the doctors that I've had. I probably had like one amazing doctor to describe it perfectly, then you, and in a way that I can understand it.
Yes,
I'm
okay.
not a doctor and I'm not a guy.
It's not that we woke up one day without eggs, So it's just the quality, basically, like it's not the same. But we can improve that quality. And imagine, if our chances to get pregnant is like 30% now, imagine that we can improve the egg quality by 10, 15%. I'm giving you already a lot of hope,
It's amazing. Well, everybody,
Yes.
all of you know, if you're going through struggles to conceiving, you know that this is a way for you to keep in mind to stimulate, anything reducing inflammation. And I don't want to take much of your time because I feel like I could be talking for ages with you about
Yes.
this. And we will definitely have another podcast again.
Yes.
Thank you so much.
This needs a lot of
There's a
hours, there is a lot of things to say.
So the next podcast is going to be after I go and try it, and then I can
Yes.
tell you how I felt.
Exactly. Yes.
Let's do that.
Exactly.
Thank you so much.
Amazing. We will do that.
Thank you.
You're welcome. Thank you for inviting me.
Thank you guys for watching IVF Daddies.